you for being here today. I'm happy to be here before I start my presentation, I would like to thank you, Mr. Henry Lewis. He's the one who introduced me to this wonderful organization. He's my coach, so I learned a lot from him. And second person I would like to thank is Gina. I think she's not here, but she's the one who encouraged me to apply to present my company today. And the third person I would like to thank is Kristen, who helped me to prepare for this presentation. So, my name is Tran Nguyen. I'm a pharmacist. Kristen asked me why I want to become a pharmacist. I gave her a very long answer, but I just want to tell her that, hey, I want to make a difference in someone's life. So I graduated in 2008 at OU College of Pharmacy. I worked at the VA Medical Center for 2 years. After that, I worked at Walgreens since then. So I'm a retail pharmacist. Stayed behind the counter, looking at the computer for 10 years, counting pills and selling prescriptions. And I don't think that's made a difference in someone's life. I do that for many years. I do make a little bit difference, but not much. Until someone would call me up and say, hey, Tran, I need help. Something wrong with my medication. She had 20 medication, and she told me that she didn't feel well. So she asked me how much I charge her, and I said, I never charge any people about my consultation. Like you can go to any pharmacy and ask pharmacists. No pharmacists charge you, right? Same thing. So I told her I'm going to help her, but I'm not going to charge her. But that gave me an idea that, hey, there's a need in the community. Somebody needs help. Probably more seniors need help. So that's why I created my company to educate patients about medications and also about their chronic condition. So what's the whole point of this? Is to save money. I'm going to take 20 medications. That's a lot of co-pays every month. That if you can downsize that list, that saves money and eventually save lives. Why? Because a drug interaction can cause death. That people overlook about that. And this is my book. When I learned about doing business from Henry and also some people online, I learned all business stuff online from Henry. So one of them told me, hey, write a book. Tell people about what I'm doing. So I explained in my book that this service is helping to make a difference. So if you know someone or you take multiple medication, it's time to think about it and go talk to a pharmacist to figure out the right one or the wrong one that you want. So the second question that I want to say is what my company about is to solve the polypharmacy problem. So multiple medications from multiple physicians and from multiple pharmacies. Multiple pharmacies can be from the doctor office, samples from doctor office, mail order, and now you have Amazon, right? So who's going to look over that? Nobody. So if you order medication from the internet, online, or mail order, there will be no pharmacist to look over that drug interaction for you. Our target market, initially I think about seniors, but when I work with a lot of patients, I find that I work with their spouses and their adult children more than with the patient. A lot of times, adult children and spouses are the ones who fill out the pill box and want to know about drug interaction and side effects. They're the ones who are more interested about the service. So the medication management is the main service that I offer. But underneath that, I also help them to get better. So you just not help patients by medication. You have to tell them how to live healthier so they can get off medication that they don't need. I also help them to, I offer health testing. So teach them how to measure their blood pressure correctly or how to measure their sugar every day or even monitor their cholesterol. Pharmacogenetic testing is a new service that I offer. Does anyone know about pharmacogenetic testing? No clue? Have you heard about 23andMe? Yes, FDA just approved that test. So that test, most people use that test to determine their disease or their ancestor genetic. But this test specifically for medication. So I give you an example. For some patients, they take 1 pill of hydrocodone, they pass out, right? Called dizziness, can't do anything. But a lot of them take like 12 pills a day without a problem. Why is that? Because everybody make up different genes and they digest medication differently. So if you're on a depression medication and the doctor keeps changing your medication, why is that? Because your gene doesn't, the enzymes that digest the medication is not there, so the drug doesn't work. So that's what, yes?
1 minute.
So this is the drug interaction, side effects, and drug response that I talk about that define the medication management. So for this year, I spent a lot of time giving out free consultation and education to patients. I partner with home care agency that help patients at home. So I do a test drive with them to see how clients react to my business. So for next year, I will hopefully target a local physician and tell them that I can help their patient to manage the medication. So what the community can help me? Basically give me feedback. I think that's why you do today, give me feedback that help me to go on to the next stages to market to local physician. That if you know someone needs help, just let me know. And thank you very much for your time. And take questions.
Okay, don't go anywhere. So the way our format works here at One Lake House is we do a short presentation from the entrepreneur, and then you get to ask them questions. So we have about 15 or so minutes for questions. So I'm going to start. This is an issue that has affected my life personally. My mother-in-law was in hospital last year because she had several medicines that afflicted and almost killed her. Is this a subscription-based service? Is it a monthly fee? How does someone pay for your services?
Well, I talked to several companies. They say that they don't contract with individual pharmacists like me. They only contract with doctor office or pharmacy. So basically right now I'm doing cash based. And then Henry suggests me to do subscription. Basically I help to maintain, after initial contact, I help maintain every month to manage the medication. So that's what we go to the subscription base. Okay. Yes.
What is the benefit to local doctors if they're working with you?
Well, there's a new law come up now that doctors have to, one of the services they have to offer to the patient is to manage the medication of the patient, to make sure the patient gets well. So if you collaborate with a pharmacist and get that service, then the reimbursement fee, they will get better reimbursement. Same apply with the pharmacy. So if they have this service at either pharmacy or doctor office, then both of them will have better reimbursement rate and better evaluation. Yes?
So, you may have said this, I might have missed this, but if they can only partner with doctor's offices. Have you considered selling your services to doctors? In other words, being a consultant for a doctor's office?
That's what I'm going to do next year.
Okay.
Yes, because my professor told me that I'm not good enough, so I have to take a board certified geriatrics before I have to have a credential in order to market myself to the physician. Even though Henry said, no, just go ahead and do it. Yes.
So, is your consultation mostly phone electronic, or do you have an office where people come visit?
So far, I partner with a home care agency. When they see patients that have problem with 20, 30 medication, I come to their house. And someone told me I should do that. But a lot of patients, they homebound. So that's the market right now I work in is the home care. So they are homebound. So I come to their house with a referral from the home care agency. But I don't have an office yet. But I have several working space that I partner with, so I can pick up order, book a room so I can live there. Yes.
So in your experience, when you are consulting with someone who's taking 20 or 30 medications, which I can't even imagine, have you found that you're able to cut down
Yes.
on the number?
At least half. Especially multivitamins, they have so many multivitamins that it's like duplication. And the rule of vitamins, if you take too much of one vitamin, you will have the symptoms that you don't have vitamins. So they didn't know that. So I educate them and look over each ingredient and say, hey, it's a duplication. You need to give up this one, take this one. So yes, most of the time I cut in half. Yes.
When or you planning to build some kind of software? Because as I understand, because I miss a lot of part, but you are like some kind of hub. When there is too much options on the market about vitamins and other drugs, you sooner or later it should be become more like kind of service, which should be like navigation or consulting. That is what are you doing, right? Because you navigate people and you can consult them how mix the drugs, what you can drink, what not, what's already too much, or some kind of this. Actually, as a software, it's much easier to build something like a base, made like software for the people, and always to update it every day, with new products come to the market, and then you just can add for the web what are you taking, what you bought, what you're going to drink, and then you add someone else, and already system tells you, sorry guy, that's it, it's too much.
Yes,
So,
that's Henry.
because you
That's
cannot
what they
visit
said.
any person, any
Yeah, I
citizen.
really want to write an app to do that for a patient because our new generation, we all like iPhone, a smartphone. So I would love to work with a
You're looking for a good coder, right?
coder, yes, because I already have a vision for my app. I know what I want on that app for the patient, and especially put the genetic information in the app. So when they prescribe new drugs, they know right away that drug will not work for them. At the beginning, they don't have to try. Yes.
Just to follow on this, there are already existing apps and softwares in the market. Maybe that would be also nice to look into.
Yeah.
And my suggestion would be like, I know an organization called Butzock in Netherlands. I'm not sure if you came across that, but they do something similar. And they have achieved amazing results, and their model has been copied in Sweden, Germany, nearby countries. So they use the self-management principles to tackle the same problem and make sure that the healthcare is more effective. So something for you to look into as well.
Yeah.
I have one question as well. How much attention do you put into living healthy life rather than making the medication optimization in the medication? How much attention are you willing to put in making sure that the patient live healthy life so that they don't enter the stage of sickness?
That's why I become a health coach. I want not just help them with medication, but get off medication and feel better. Because a lot of disease just is out from the environment, from food and water. So if I can help them with that, with medication management, it's just a start. But at the end, I want to concentrate my energy with the health coaching and wellness coaching beside medication. So people usually come to me with problem with just medication. That's how we start first. But at the end, I want to do something better. But this is a good start for me because I'm a pharmacist, right? That's all I know and that's all I do for now. But as I go for more trainings, I will learn more and expand my service to help people with healthcare. Yes.
Have you had any luck reaching insurance companies? I mean, this seems like a service that they would like to offer as a
They
differentiator and a
Right.
value to them.
Well, they have local pharmacists, their own pharmacists to do this over the phone. A lot of them say I can charge patient cash and patient can fill out the reimbursement form. They can submit the insurance, insurance will pay them back. So that's the only way I can do right now. Yes. So they can use their HSA for the consultant or they can fill the reimbursement form to get to the insurance. Yes.
What risks, if any, do you take on by making recommendations to people's pharmaceuticals? I mean, even though it sounds like you're trying to help people, right, eliminate some, their different combinations produce different results. So are there any risks by you consulting with people?
Yes, that's why they have to sign a form. Before I make recommendation, usually I will tell them to talk to the physician before making any changes. I just tell them this is what I discovered, duplication, drug side effects, how you're going to move drugs around so you make sure when you take it, there's no drug interaction. That's part I can do, but to stop or to start medication, they have to check with their own physician. And I told them, hey, introduce me to your doctor. Let me work with your doctor to help you. That's my message to my clients right now. And that's the way I knock it to the doctor. Yes.
I have two questions. So the first one, to partner with home health care agencies, are you just looking for them to refer you to the clients who are having issues kind of managing their drugs? And the second question is, could you tell us a little bit more about your personal story of being Vietnamese Canadian American?
Well, I'm very proud of that. I always tell people I'm different. Well, I grew up in Canada. I was born in Vietnam. I grew up in Canada. I went to the University of Western Ontario. I have my computer and math background, so I love about computer. But then I get to pharmacy school at OU. So that's how I got all my. I'm proud to say that, but I'm just a immigrant. And partner with home care agency. So far they will prefer customer to me, but I tell them, hey, we split the profit. You know, they have to earn something, just not free. So I tell them, hey, I haven't written anything on paper yet because so far I haven't charged any of their patient yet. So that will be the next step. We have to sign the agreement that, hey, we prefer patient to me, basically split the profit. Yes.
So this question touches on both the risk point and the Canada point. I have a couple of senior friends who get their pharmaceuticals from Canada.
Yeah.
And they do it to save,
Cheaper.
lots of money.
Lots.
Do you have an opinion about that in terms of the advice that you give?
Well, my sister is also a pharmacist. She's a Canadian pharmacist. So I know the rules. Well, in Canada, you have to have a Canadian physician to write a prescription to fill in Canada. Because I tried to help someone to buy medication in Canada, and she told me you cannot do that. You have to have a local physician in Canada to write prescription. So most of the one online, I don't know how legit it is. Because Canada rules, because I want to buy from her pharmacy for the medication, like EpiPen. You know how much EpiPen costs? Yeah, like over $500. Can you know how much in Canada? $150. Really cheap. A lot of medication really cheap because the government controls the price. So yes, but it can be either ways. I don't know how she get it. And that's what she told me. That's the rule. You have to have a Canadian physician to write prescription again. Maybe they partner with a physician to rewrite prescription. Yeah. So that's a Canada.
There's that too.
Okay, are there any final questions?
Yes.
Is there an opportunity for you to deliver medications?
Deliver medication?
Yeah.
home health care facilities, do they deliver?
Then I don't know. I haven't looked into them yet.
Okay.
But I don't
Because you
know.
said there were a lot of people that were homebound.
No.
So,
Well, Bao has two kinds of home care and home health. Home care doesn't do any health stuff, so they don't want to involve to health stuff. That's another legal. So that's how I know it. But I haven't talked to anyone about in home health about my service.
it could be something that when you talk about your medication management, people that don't take their medicines as prescribed, you could do daily or weekly
Right.
delivery, something like that.
That's why I come in and make a schedule for them. I will tell them exactly what medication in the morning, afternoon, at dinner time. When you have someone that figures that out for them, put on like a calendar. So that would help them. The reason they don't want to take